Today our topic is IV fluids. We will discuss about the IV fluid, what IV fluid we should give in which situation. We will discuss about it. The choice of IV fluids we should decide. This include normal saline, ringer lactate, plasmalyte, colloid, and many more. First of all, we will discuss about the normal saline, 0.9%. Normal saline should be choice in very conditions. These conditions are hyponatremia, condition number 1, hyponatremia, condition number 2, vomiting, condition number 3, brain edema, condition number 4, traumatic brain injury. So where is traumatic brain injury, we should use normal saline, not the ringer lactate. So normal saline should not be used in which situation, we will discuss about this also. Number 1, acidosis. Number 2, chronic kidney disease. Number 3, sepsis. Number 4, shock. In all these situations we will not use normal saline, we will take care about it. Second fluid we will discuss about is ringer lactate. Ringer lactate can be given in many situations like metabolic acidosis, hyperkalemia, diarrhea, hypotension. It better avoided in many conditions like traumatic brain injury, where the fluid of choice for the transfusion is traumatic brain injury is normal saline. RL should not be given in traumatic brain injury. Another condition where RL should not be used is liver dysfunction. Third one is when patient is on blood transfusion, we should avoid using ringer lactate because the ringer lactate contains calcium and contains calcium, and patients on blood transfusion, if we give the calcium, it can cause the chills in these patients. So we have discussed about normal saline and ringer lactate. We will discuss now plasmalytes and colloids. Plasmalytes and colloids are best IV fluid because they can be used in any condition. These are used very less in common practice because these fluids are very expensive. Now here we are discussing few conditions. For example, in which situation we should use which fluid and by which route. So there are many conditions like dehydration, poor nutrition, diarrhea, vomiting, blood loss, and in these conditions how to give the fluid in by which mode to the patient. In dehydration we should focus on the oral route, or if patient is not able to take by orally, then we can give fluid by Ryle's tube. In poor nutrition condition, we can give the fluid by oral route or by Ryle's tube. The fluid and diet should include the high protein content. And very common conditions like in diarrhea we should give the RL fluid, and in vomiting we should use the normal saline. Now we will discuss about the conditions having blood loss. So in condition where blood loss occurred, the first primary choice is blood products, and if blood product is not available at that time, secondary choice is crystalloids. Crystalloids should be used in 3:1 ratio. For example, if blood loss is 1 liter, then crystalloids should be given in 3 liter. So there will be 1:3 ratio. If patient have hypotension due to blood loss, then colloids should be given till availability of the blood. In critical patients or patients having poor renal function, first choice to give is plasmalytes or colloids, and secondary choice is RL fluid.